Good afternoon and welcome to today's IAC webinar, Perception, Prevention, and Protection, Vascular Ultrasound and Work-Related Musculoskeletal Disorders. My name is Kelly Baer and I am the Creative Design Manager with Marketing Communications at IAC. Before we begin, I'd like to take a moment to review a few technical matters and let you know how you can participate in today's session. We would like today's webinar to be interactive, so we encourage you to submit questions. To do so, use the Questions tab located on the left side of your screen. Please submit your questions anytime during the webinar, as we will monitor questions throughout the presentation and try to answer as many as possible during the Q&A period. Also on the left sidebar, please note the Resources tab. Click this tab for a link to today's handout, a PDF copy of these PowerPoint slides. Select the file name to download the handout. Lastly, in the lower left of the player, please note the Request Support button. If you experience any technical problems during this webinar, click this button. A technical expert will be there to assist you with any issues you may have. For those who like to take notes during the presentation, look to the right of the slides and click the Notes tab. There you will see a white text box where you can take notes on today's webinar. These notes will be emailed to you automatically at the end of the session. To be eligible for the SDMS CME credit, you must be registered, logged into this webinar, then complete the survey. The link to the survey will appear on your screen automatically at the conclusion of the live session and also be available from the IAC webinar portal for 3 business days. If you are viewing this webinar in a group, please be sure you are also individually registered and logged into this webinar on another computer or device so that we have record of your attendance today. Today's presentation is being recorded and will be posted at a later time for on-demand viewing. This webinar is a joint presentation of IAC and SDMS. And now I would like to introduce today's guest presenter, Jean White-Melendez. Jean White-Melendez is the Program Director for ESP Ultrasound, LLC in the Woodlands, Texas. She is nationally recognized as a premier expert in venous disease and vascular testing and is a frequent lecturer throughout the U.S. She has previously served as an application reviewer and site visitor for IAC vascular testing. She's a true expert in the field, and we are happy to have her with us today. And with that said, I will now turn this webinar over to today's speaker, Jean White-Melendez. Jeannie?
Hello, everybody. I hope everyone's having a wonderful day so far. Hopefully you've been able to clear your schedule for the next little bit here. And I'd first like to thank IAC for welcoming me to this platform on this very important topic. So, perception, prevention, and protection for vascular ultrasound and work-related MSK disorders. I have no financial disclosures, but I'd like to acquire these following objectives. I'd like to meet these. Describe work-related musculoskeletal disorders. Hopefully by the end of the lecture, you'll be able to understand the potential effects on the vascular sonographer, learn corrective positional changes while scanning to reduce the risk of injury. And we've put demonstration videos on resistance training exercises to improve strength and flexibility, and also to consider how to identify those best practices to reduce injury. So first and foremost, what are work-related MSD injuries? Well, we know that they affect the muscles, the nerves, the ligaments, the tendons, and even cartilage. Caused by or aggravated by workplace activities, develop gradually, they are painful disorders, and they account for up to 60% of all workplace illnesses. So, how do you develop these conditions? Well, I think it's really 3 parts. 1, it's part of the job or our scope of practice. 2, Sometimes the organization for which we work for or with doesn't have an appropriate or doesn't even have an ergonomic policy. And then also, we must take responsibility. Personal responsibility is going to help us to reduce our injury. So, what's part of our job? Well, all of us know after many years of scanning for myself, now that I hit my 30 years, oh my goodness, no thank you, of scanning, that I do a lot and have done a lot of extension of my wrist. I've used my shoulder way too much, right? Reaching is just part of our job. Forward flexion with that shoulder, bending, twisting at the waist, bending, rotating the neck, lifting not only patients, but different parts of my body in order to perform the exams. Lots of squatting and lots of repetition, which is really where the hinge pinch on the development of the injury. Now, as far as the organization that you work for, the organization you work for is certainly not the enemy. A lot of times it's just a matter of them having a lack of understanding of what it is that a vascular sonographer actually does in a daily routine of work. So, because of that lack of knowledge and time is money, exam times are often absolutely not appropriate. So, we'll touch on that just briefly. The patient load. Well, we're in the business of vascular disease, and with vascular disease comes emergencies. We don't want patients dying of pulmonary embolus or ruptured aneurysms or having strokes. So we're in the business of add-ons. And that's part of what we know is going to happen on any given day in a vascular laboratory. Our room size might not be appropriate. And then there's some things that can be very helpful to us, which is equipment that's actually designed to prevent injury. Exam tables. What exam table are you using every day? What chair, if you're sitting for part of the exams that you do, what chair are you using? Your machine, does it have, and most modern machines have, flexibility with screen or keypad or maneuvers, and then transducers themselves. They've come a long way over 30 years. Now, as the vascular sonographer, one thing that we know about each other is that we are caretakers. Most people that get into medicine get into it because they love people and they're givers. So we tend to put our patients before ourselves. So we really want to kind of think about ourselves for a moment here. We think about the positions that we get into. Sometimes we forget or fail to adjust the equipment because we're so engrossed in what we're seeing. Sometimes when we first begin, we might be gripping our transducer too much. You might feel pressure not to take a break, whether you're a type A personality that more is better, or you feel pressure from your employer or your boss. The other thing is as we age, we know that our muscles decrease and so do our flexibility. So incorporating a resistance training program could be very helpful over the long haul. Now, when I first started, I went to a Chinese restaurant and I'm really big on getting, the little fortune cookies. And I got a fortune once that said, become the most positive and enthusiastic person you know. And so I took that little fortune cookie paper and I taped it to my laptop and it lived there it was actually my screen because I didn't have a laptop when I first started. And I left it there because I thought if you have a positive attitude about life, then the likelihood that something bad that would happen to you would be less. That was just my thinking. But what I've learned over the years is sometimes optimism, too much of a good thing. sometimes optimism creates something called an optimism bias, where you end up overestimating, because of this big positive attitude that you have, that negative things aren't going to happen. For instance, if for related to your job, if you don't save any money or have an emergency fund because you're positive you'll always have a job, you might end up without an emergency fund and in a bad situation. In a healthcare setting, this can manifest itself as a serious underestimating of a risk. And in organizations, an optimism bias might look like a lack of a risk management plan because they underestimate the likelihood of the risk. So be careful about optimism bias. Although I still want to be known as the most enthusiastic and positive person that anyone has met. Now, wonderful work has been done by SDMS, and they actually even have a landing page as part of their website about everything that you need to know about work-related musculoskeletal disorders. And Kevin Evans and Joan Baker and Roll all have been very influential in gathering the data to give us the support to the argument of why we should all be thinking about this, no matter how positive we are, that we're so strong and so young, and this is never going to happen to us. So, how many people that are vascular sonographers report symptoms as they move through their career? 90%. So, it would be negligent to think that you won't end up with a symptom of some type of MSK disorder at some point in your life if you continue in this field. So what's the staging of the work-related disorders? What are the symptoms? So in the early stages, you might have some aching, tiredness. It affects the limb. It occurs during work or after you've done X number of like venous insufficiency exams, or you've had 4 patients in a row that were morbidly obese and you were asked to do renal ultrasounds on them. But then it disappears at night. And when you're off work, you completely forget about it. And so it doesn't affect your work at all. As the stages progress into an intermediate stage, now you have aching and tiredness that occurs on your first renal of the day or your first venous insufficiency exam of the day. And it also is now persisting at night, maybe waking you. Now you start to pop Advil or Motrin, and it's starting to reduce your capacity for repetitive work. So you start to, I call it like the low grumbles. You start to talk about your neck and your shoulder and your back, and you're like, I don't know what's wrong with me. In the late stages, now you have this aching fatigue, and you might even have weakness because now the nervous system is involved, and you might have so much inflammation that weakness happens even at rest, and you might not be able to sleep, and you can't even perform your duties. The impact on the body most likely will occur to the shoulder, such as a tendonitis or a capsulitis. You may have heard the term frozen shoulder. You might end up with neck pain or back strain. You could end up with inflammation around the elbow or even carpal tunnel syndrome by the wrist. The signs and symptoms will include pain, burning, tingling, numbness, muscle fatigue, decreased grip strength, so you might not be able to hold the transducer like you used to, decreased range of motion, loss of function, and in the worst cases, end up with a deformity. So you're saying, Jeannie, you're telling me all these things about being a vascular sonographer. This sounds horrible. This sounds like this might ruin my life. Maybe I need to think about getting a different job. Well, I would say, don't think like that, right? Because we don't want to change our job. We love what we do. And I thought that this was a great tribute to Dr. Strandness from the University of Washington, whom, if you're a vascular sonographer, I'm sure you know who he is. But he was literally quoted to say, "I have often commented on the extraordinary role the vascular technologists play in our healthcare system. In fact, I cannot think of anyone not possessing a medical degree who has the same amount of responsibility to the patient, whose welfare and often whose outcome from an illness depend on the accuracy of the studies being done." If you didn't want to be a vascular sonographer before this, you want to be after he talks about us in this way. Dr. Strandness was one of a kind. So we don't want to quit our jobs, but what we do want to do is protect ourselves and be smart about it. So what can we do? So what about some corrective positional changes to reduce the injury? First and foremost, do not overreach. Your lever arm, or I always called it my scanning arm, should be at 30 degrees or less. So you don't want to abduct your arm greater than 30 degrees. And I'll show you in some videos coming up. You want to make sure that you rotate towards the patient or have your patient scoot closer to you. Do not over twist if at all possible. Standing straight with your back straight, you can always correct your posture. As we age, we tend to roll those shoulders forward. Move the ultrasound machine closer to you. Adjust the ultrasound machine. Don't forget. And if you can adjust your chair, adjust that. You can also probably adjust your display screen. I know it's one extra button to touch or one more thing to do while you're touching 1,000 things, but those little tiny things might be very helpful. Do not tilt your head. Consider switching hands. Reduce your transducer grip. Modify the amount of excessive force and pressure that you use. Now, the patient population, not just in the United States, but in the world, more than half of the people are obese. So you're going to see obese patients. It's just part of the job. So don't forget, when you have to press in, let's say for a renal ultrasound, don't forget to ease up and then do some post-processing with your images. Don't have that continuous pressure. If you're doing venous ultrasound and you're doing insufficiency studies and you're standing the patient, maybe you'll get a platform. So let's talk about some abdominal duplex corrective positional changes.
So the first thing, you want to make sure that your body is rotated towards your patient. We're all working on trying to shorten this arm here. The next step you want to do is ask your patient to scoot over closer towards you. This is already starting to shorten her lever arm. The next thing, if she looks to the left, her head is now going to be in a twisted position. That is not good for the shoulder. So the next step is to move the machine closer to the patient and then also raise the machine to a higher position. You do not want your head tilted downwards. So back to the position now. You can see that this arm is much more shortened. This puts a lot less stress on the shoulder, and then her neck is at a neutral position right now. This is the proper setting.
How about carotid duplex corrective positional changes?
So in this scenario, she's again very, very twisted. The first thing you want to start with is ask your patient to move closer to your machine. Good. And the next thing is move your computer closer to your patient. And then now this has already shortened her lever arm here. She can now rest it even on the pillow. She can rest it down there so her arm is not being stressed. The last thing is that her posture was a little curved in the beginning, and then straightening up your posture so you're closer to your patient. Now, even when she crosses her arm, it's still not an issue with the twisting.
How about lower extremity duplex corrective positional changes?
So in this scenario, she's very, very twisted. Ideally, if you're ambidextrous, you're going to grab with your left hand. You're going to switch your right then to the calf muscle. This will put the shoulder in the proper position and not over twisting.
How about venous insufficiency corrective positional changes?
In this scenario, her posture is very, very curved forward, and she's also twisting towards the screen. So the first thing you want to do is lower your computer, so go ahead and do that. Lower the computer, and then also lower your seat height too. Good. And then you can also instruct your patient to do the same calf lift, same dorsiflexion, versus twisting and squeezing the calf.
And up.
She's in a much better position now, and her head is not twisted nearly as much.
So the other thing about venous insufficiency is oftentimes you can accentuate the exam by selecting exam tables that are corrective for this type of work. So if you are on a budget and you're poor, like my business partner Bill Schroeder and I, Bill was able to go ahead and make a platform for us. So Bill made this with love. Or if you're in an organization that has a little bit more money where they can invest, you can have one of these tilt tables. And if they're willing to invest a lot more, because this is manual, you can have electric tilt tables too. And so if you're going to be asked to do 8 studies or 10 studies a day, you're going to need equipment that's supportive of that endeavor. What we love about IAC is, yes, when working in an IAC vascular accredited facility, part of the standard is that we make sure that our patients are safe as well as our faculty is safe. And so part of the policy, if you work in an accredited laboratory, is that you have an ergonomic policy. And the policy must be in place to address the technical staff safety, the comfort, and avoidance of work-related musculoskeletal disorders. So the guidance for how, if you are a manager of a organization and you're on today's webinar, you're probably going, well, how am I going to make this policy? How do I make sure we protect our technologists? So you can go to the SDMS website, and again, they have that landing page where they have great information where you can pull together a policy. But what the take home of this is we understand that it's a team approach. Their employer definitely has responsibility. The vendors are doing their job by constantly making their equipment better and more ergonomically safe, but the sonographer also has responsibility. So another thing as part of the ergonomics policy is this whole thing of how long do you get for the test? Because if your repetition is the evil of this, right? But we know that we're going to do repetition when we do vascular testing, so we can't get out of it. But what we can do is give the appropriate amount of time to perform these exams so that we can make these small corrective changes by getting the patient in the right position, getting ourselves in the right position. Every motion that you make, every movement that you do, every button that you touch is costly because it takes time to do, which is why SVU worked for years and years on making the proper amount of minutes in order for us to do these exams. So SVU has these guidelines in place, and they were made in 2019. And you can just take a look at the different types of tests that you do in your laboratory. And we do so many different types of tests, and how many minutes is allotted and agreed upon by SVU and many organizations that signed off on this, right? So who wouldn't love 60 minutes to do a carotid duplex exam? Who wouldn't love 92 minutes to do a renal? And who wouldn't love the lower extremity venous exam, 70 minutes? Well, what if you're doing an insufficiency study versus a rule out obstruction study? They're two totally different, going after two totally different things. So Bill and I ran quality vascular imaging down here in Florida for over 22 years. And these are what I call reality minutes, because I have the unique role of first a sonographer, but then a business owner. And so I understand when organizations or physician groups want to squeeze you down on time. But the fact is if you go to whoever's in charge of making the ergonomic policy, the argument could be, look, we're not asking for what SVU says the standard guidelines for time are. We're asking for some minutes here to be able to add these onto our schedule so that we can protect our sonographers. So you're not asking for all of these minutes, but you're asking for more minutes than something unreasonable. If you go on Facebook and you look at any of the chats, I see technologists posting, oh, it only takes me 20 minutes to do a bilateral carotid, or I can do venous ultrasound bilateral insufficiency exams in less than 30 minutes, no big deal. And I've been doing this for many, many years. And yes, you do get faster and better with time, but at what expense? That's what I want to ask. At what expense? So, time to go shopping. So you can, if you're in charge of an organization or you're a manager, you can buy for $54 on Amazon. I looked this up the other day. You could buy an entire pack or a roll of, and it doesn't matter what brand you get, of this resistant band. Or if you're just shopping for yourself, for less than $15, you can get different levels, because each color has a different level of resistance. And that's really all you need to make yourself a little safe. So the gentleman that you saw correcting my position when I was scanning, his name is Xander, and he is a physical therapist and a great friend of mine. And what we came up with 5 easy steps that you control. With a resistance band, you will do these exercises: bilateral external rotation, horizontal abduction, D2 flexion, bicep extension, and wrist flexion. So what am I strengthening when I do these maneuvers? So since we're focusing on the upper body, which is what really gets the most use in our profession, is for bilateral external rotation, you're helping your shoulder and all the ligaments and joints there, so all those rotator cuff muscles, as well as your posture. The horizontal abduction helps strengthen your trapezius, your rhomboids, and your posture. The D2 flexion helps your lower trapezius as well as your posture, and it can prevent thoracic outlet. And so you say, well, wait a minute, Jeannie, I'm a thoracic outlet expert because I'm a vascular technologist and I understand that it's the vein, artery, and nerve that go through that space. Well, when you're first learning this, you learn about the extra rib, right? But one of the other things that can happen with thoracic outlet is if you have this overdeveloped muscular section in your neck area, either the scalenal or costoclavicle, in that costoclavicle space, if these muscles are overdeveloped, which they can be if you're doing constant movement, then they too can end up, pressing in on that nerve. And in the worst cases, vein and artery as well. Now, the bicep extension will help strengthen your biceps and the tendons down here so that you don't have so much elbow pain or tendonitis there. The wrist flexion can help your extenders here in your forearm, and they can strengthen and stretch and prevent carpal tunnel. So let's go through some injury prevention exercises.
So this is a TheraBand. It's very simple, easy to use. You can collapse it, keep it in your purse, in your backpack. Easy to use. You'll use these for most of your exercises. Very compact. They come in different colors. This one is kind of a medium resistance, but it works from light to heavy. And you can kind of work your way up as needed. All right, the first exercise is external rotation for both shoulders. This exercise focuses on your posture more than anything. So if you can see, if you have rounded shoulders, this is going to correct your posture. Same thing as forward head as well. The next one is very similar, still working on your posture, working more on your middle trap and rhomboids. Making sure you really squeeze back your shoulder blades, pinch them together, and repeat. Another exercise for your posture. One hand is by your hip. You're going to lift the other at an angled position. Make sure that your thumb is pointing directly up towards the sky. You'll want to make sure that you do both sides on this one. This one targets your lower trap. Again, great for posture. This will also reduce the risk of thoracic outlet syndrome. This exercise is working on bicep strength. A very common tendency is for hyperextension of the elbows. You want to make sure that you're activating your biceps and not going to full hyperextension because we're trying to avoid that. This exercise is for your wrist strength. This is related to carpal tunnel syndrome. You want to make sure that your extensors are strong. You'll also want to rotate and do the same thing pulling up towards you. From a different angle.
So the recommendation is these 5 easy exercises and you do 20 reps of each one daily. And we think that that would be a really good start at a program for yourself. So, how do they develop? Physical demands of an RVT, an RVS, or an RPhS are just what they are. It's going to require these types of repetitive movements in order to be successful at gathering your images, right? So having a lack of an ergonomic policy contributes to this, and also having that patient caretaker first and self caretaker last. So we really have to change the perception. So why do they occur? They occur from repetition. They develop gradually. They're really common for sonographers, especially vascular sonographers. So we want to demystify that bias that it's never going to happen to you, that you're young, that you're strong, which may be in fact true. And if you're lucky, if you're in the 10% of people that never end up having a musculoskeletal disorder, that's wonderful. But I say that we are proactive about this, that we take care of our patients, but we take care of ourselves, and we take care of those that work with us or for us. We make sure that we do prevention to the best of our ability. We adjust our body position. We adjust our equipment. We take breaks, which means that we need the appropriate amount of time to perform the tests that we currently have on our plate. Maybe part of our program or part of our schedule, if we're going to have really short periods of time or not enough time to do all the tests, there should be built-in time for add-ons. So how can you ask sonographers not only to shorten the length of the time of the test that's already on their schedule, but then also give them all these add-ons? So if you know that there's going to be add-ons, then that should be included in part of the schedule. Strength training is what we do for ourselves. So if you happen to be a manager, or you are willing to take this on as being someone that is a cheerleader for your team, your group of sonographers that work together, maybe you go ahead and get everybody bands and you follow this in between and you encourage one another. If you run into one of the rooms just to grab some more ultrasound gel or more table paper, and you notice that your fellow sonographer, your friend, is got a terrible position, you gently encourage them or discuss with them, maybe not why they're with the patient, but you discuss with them, hey, you know, I happen to notice that when you're scanning, you're doing this. And I'll tell you, as you age as a sonographer, you learn that, you know, all of us are going to lose muscle mass as we age, okay? And then protection, you get an ergonomic policy. If you work in an accredited lab, you should have an ergonomic policy. Well, what are the words in that policy, and are they being enforced? So make sure that we adjust those scan times. So important references for today's lecture. Again, SDMS has a wonderful landing page with all kinds of information, has pretty much brought together all the important historical papers that give you all the stats and the details of what should be part of an ergonomic policy, and the facts behind that support all this. And then SVU has your practice resources, the professional performance guidelines. So that's a wonderful source of information. And then the CDC has awesome workplace solutions. So hit any one of these websites if you are interested in creating a great ergonomics policy. So I'd like to thank IAC for inviting me back to the stage to talk about such an important thing. And I would just like to say, I hope that everybody takes care of their patients, which I know that you will, but don't forget to take care of yourself as well and your teammates. Okay? Have a wonderful day. Thanks, IAC.
All right. Thank you very much, Jeannie, for that talk. And at this time, we will begin the Q&A session. From IAC, I'd like to introduce March Hutchison, Director of Accreditation for Vascular Testing. March will assist with the Q&A session today. March, would you like to start us off?
I would. First of all, let me say thank you, Jeannie. I mean, you touched upon the things that every one of us is hitting every single day. There's a lot of questions about how do we get our employer to understand what's going on in the lab? How do we get them to, care about all of that? And how do we get started with a program where we can actually include exercises and that sort of thing throughout our day?
So thank you, Marge. So the way that we handled this, because my personal experience, first I was an employee of an organization, and at that time there was a handful of technologists that worked for a group of 10 board certified vascular surgeons out of Cincinnati. And at that, and this is like the 90s, right? So this goes way back to the day. And we really didn't think about, injury, or we were just so excited to take the transducer, put some gel on a patient and look inside the body and see. And it was really like so much of the pioneer and the work that came out from that. And so we really weren't thinking about it at all. But over time, and it's interesting because I remember when I started to think about MSK and injury and all this, because I too have that positive bias where I thought, well, it's not going to happen to me, and I'm strong and I'm athletic and I'm in shape, so I don't have a problem. So what I noticed was 5 years in, I all of a sudden had this issue where with my neck, that was the first place, neck and shoulder. And I remember going to my employer and telling them what was happening. And they said, well, cell phones had been coming out. And so they said, well, it's probably cell phones. And so I thought, well, maybe in fact it was. And not that using a cell phone, or, when you prop it on your shoulder, that doesn't contribute to this, which it does, right? So anything that we do in bad position is always going to contribute. But I would say to whoever that person is in your organization, whether it's a manager, a director, that you ask very respectfully for a moment of their time. Now, before you ask for that moment of time, you go to the SDMS website and you look and gather all the information. You'll have this lecture, but you can have all this information as far as like exam times and proper ergonomics, the room setting, the equipment setting, and you can literally make a checklist and then decide, well, where are our deficits here? And then by looking at that and having a meeting with them for the very first time, I mean, when anybody hears that, then I take my employee hat off and I become the employer, right? So now I have 10 vascular technologists working for me, and I'm wanting to keep them safe. So, there's always going to be adjustments that are made. And one of the biggest things is that time, right? The amount of time that you get for testing, and then the bed that you use and the positions that you get into. So when you talk to this person, if you come with the attitude that you are in it to make the changes together, that you're not blaming the organization or that you're going to go after the organization, right? That you still want to do the work, you just need these tools in order to do it well. That would be my approach.
Great. So Jeannie, the bands, are they good enough for people who already are feeling like they have an injury?
Yeah, so this was what is crazy, what I've learned over this last year working with this physical therapist was I always thought that once you were injured, now there are some injuries, of course, and I'm not here to diagnose anybody, but there are some injuries that once they are to a certain point, you might in fact need to go to that next step of either surgery, but certainly physical therapy. And I think that anybody would, vote for go to physical therapy first. Well, what is physical therapy? Physical therapy for any of the symptoms that you might already have is exactly this. And so this physical therapist designed these 5 things because he asked me to show him what are the majority of testing in the positions that we get ourselves into as we're scanning. And so by me showing him those maneuvers, then he put a lot of thought, energy, and effort into, okay, what are the corrective positional changes, but what would be the exercises that would most likely ward off developing an injury. And so I learned so much because it's just not about the muscle strength, right? That's it, that plays a part of it, but it also is about active flexibility. One thing that people talk about is doing yoga and things like that, and not that that won't be helpful too, because that has a lot of mental help as well as flexibility things. But the active flexing is both strength and stretch. When you combine the two, it's very, very helpful. So yeah, there are people that had symptoms of carpal tunnel, but were able to do the wrist maneuvers and the symptoms subside. Or people that have what they're developing like an adhesive capsulitis of the shoulder, and they start doing the maneuvers of the shoulder exercises, and the symptoms subside. So it's physical therapy is, I can't say enough about it. It's fabulous.
Great. Jeannie, you did not really address bedside cases. Now, what about these folks that have to push their machine through the carpeted hallways and go to the ICU where there's a million other machines going on? How can they even begin to avoid getting hurt?
Yeah, so the thing is if you are doing that, all day, every day, the issue is the repetition. So yes, it's true that if you're going up to the bed, hopefully, if you're going up to bedside, you work in an institution where there's several people that work there too, and so a lot of times, what we'll see as part of the policy is rotation to who takes bedside. And maybe not rotation by day, but rotation by scan or sets of scans. Like if you go up to the floor and you're already up there and then another call comes in for another patient, well, then you would do that one too. But then go back down into the lab and then the next person goes out and things like that. Because you can have from repetition injury, sometimes it's the person that's in the same room all day long in the same positions where the bed is in the same place and the machine is in the same place, and neither are ergonomically friendly, and the chair's in the same place. And they are the ones that are going to sometimes suffer more. That when you go up to the floor, yeah, pushing the machine is a thing, but it's on wheels, so you should be able to maneuver that pretty well, even on carpet. And once you get up to the floor, yes, you might get yourself in some pretzel positions at times, but it's abbreviated. And then you're done, you move your machine, you go back down. Well, believe it or not, that reprieve of going back down the elevator, back to the floor, back to the home front of the vascular lab, that stop of repetition is often very helpful. And so in between, you could certainly have your band and do any type of, strength or stretching.
All right. this is an interesting situation where this person, they have great support from their hospital. They have ergonomic policies. They have been able to adjust their appointment times. They have all the ergonomic equipment, but she can't get her sonographers motivated to care about themselves. Any thoughts about that?
Oh man. Well, I would like to say that there is thousands of people that would like to know where you are working because that what a wonderful thing. This person that's asking the question sounds like the kind of person that I would want to work for sure. So that's really interesting. And I think the best thing is just awareness. It really is interesting. How do you get someone to care about themselves when they don't seem to? And so I would say, maybe that's an old saying, but you can bring a horse to water, but you can't make them drink. And that's the case. The good news is that you have all these parameters in place. I would say, gathering them together, like I would assume that you're going to make sure that they all listen to this lecture, that they, in service, like a lunch and learn, where they actually find out about it. A lot of times what happens as sonographers, I think when I was hearing about it, it didn't even dawn on me until I thought backwards, like, oh my goodness, I've had MSK symptoms for a long time and ignored them, right? Because just so busy and, didn't want to jeopardize my job, my career, or anything like that, or my patient. So, it's a tough one, but I would say that doing like a lunch and learn, having the information available to them, eventually they will listen. They will, because it will present itself if they don't make adaptations to it.
Mm-hmm. Very good. So this one person says that their facility reports no injuries ever. So in my own personal opinion, I would say that they're just not capturing those things. They're not reporting them. I can't imagine that sonographers don't have injuries.
Well, I don't know what their policies are or what their what their volume is, or what actually that is. I'm not sure if they're suggesting that what they're reporting isn't correct or that they truly don't have injuries. We're not saying that if you're a vascular sonographer, it's 100% that you're going to end up with an MSK injury. We're not saying that. What we're saying and what we want people to be aware of is that the majority of sonographers, whether they're vascular or any type of sonographer, will have symptoms of MSK injury and sometime in their career. Now, in the first 5 years, probably not. In the first 10 years, now you're starting to get statistically more likely the longer you scan. So, it could be completely possible that you are in a department where everybody is under 10 years experience and nobody has symptoms, and that's wonderful. And I'm not suggesting that, we go on this crazy soapbox of, oh, how terrible this is or anything like that, because I certainly wouldn't want to come off like that. But the fact is that when statistics don't lie, people are just not making up these symptoms. And so what we want to do is we want to proactively have policies and procedures in place so that this doesn't happen to the facility. And that's really what it's about. That's what IAC stands for. That's what SDMS stands for. That's what SVU stands for. All these organizations are there to protect people and to make them aware so that they're less likely to ever have a problem.
Yeah, thank you, Jeannie. I think we got about one more question, and there's so many of them. A lot are about reflex testing and that sort of thing. But you did mention earlier that SVU recommends times, and then there were more or less some real times. Can you just review that again for them?
Sure. And I could probably, oh yeah, I don't know if I'm still sharing. I don't think I am. So basically what I did was I took all the procedure codes that we do, and believe it or not, we do like 27 different types of tests if you add unilateral and bilateral and all that. And not everybody, every lab does every type of test, but nonetheless, under our procedure code of what we're allowed to do, we have our procedures, and then we have the ultrasounds that we do most of, right? So we know that it's carotid ultrasound statistically. Now that might not be the case of your vascular laboratory. If you work in a vascular lab that's part of a vein center or something like that, then you're going to do more venous insufficiency studies than you certainly do carotids. But nonetheless, you take these procedure codes, you go to SVUs, well, you'll get access to this lecture, which I already have it there for you. So you'll have that, all those scan times. And like, let's just look at carotid. Carotid, they're recommending, the scan time that, and I want to see if so let's say they recommend 60 minutes for SVU. That's for a bilateral carotid ultrasound exam. So in reality, most labs only get about 45 minutes. I think lots of labs only give 30 minutes. And then you have sonographers bragging about being able to do it in 15, which I wouldn't really brag about that. That says something about the information. Not that you could never do a bilateral carotid in 15 minutes, because maybe you could start to finish with a stopwatch or something like that. But really, is that what we're about here? We're about longevity. So the difference of that 15 minutes is huge. The difference of that 15 minutes might be the pressured reason of why you don't want to adjust your console on your machine, why you don't want to press the button on your chair to go down or up, why you don't want to have the patient, because our patients, a lot of them are older. So asking them to move is very time consuming. So let's move them into the right position. You move them into the perfect position. Now they need to use the restroom. So they got to get up, get dressed again, go to the restroom, come back. These are all minutes that go towards how much time is allotted for any examination. The venous exam, bilateral, it's a different bugaboo to do a bilateral venous exam at 3 o'clock in the morning when the patient is suspected of having a blood clot. You're not going to be doing where you're standing them and assessing them for insufficiency. So there's a whole big long part of the exam that's omitted. So exam times for lower extremity veins by SVU guidelines are 70 minutes. We never even gave 70 minutes. We always gave an hour. Now, the reason why we gave an hour, because some exams are faster than others, depending on how much disease you come up against. And we always knew that we were going to get add-ons. So even if we gave, 45 minutes for a carotid ultrasound rather than 30, if we finish that carotid ultrasound in 35 minutes, well, we could take that 10 minutes from that exam and add it to maybe the next carotid where we have extra 10 minutes. And now we're more likely to be able to do that unilateral venous exam to rule out a DVT, right? Something like that.
Great. Thank you, Jeannie. You have presented this information just in an excellent manner. And speaking for the IEC, we're really grateful that you have taken your time to do this. I'm going to turn it over to Kelly to close us out.
Okay, thank you very much. Thanks again, everyone. And a very special thank you to Jean White-Melendez for this presentation today. Please feel free to contact IAC with any questions that were not answered during the Q&A session. To receive continuing education credit for attending this webinar, please complete the survey. The link to the survey will appear on your screen automatically at the conclusion of the live session and also be available from the IAC webinar portal for 3 business days. On the left side of the My Account page, you'll click on Webinars, look for the title of this session, Perception, Prevention, and Protection, Vascular Ultrasound and Work-Related Musculoskeletal Disorders. Beneath this title, you will click Review Event. On the left, select the Evaluations tab, then click Take Evaluation to complete your survey. Your certificate will then be emailed to you directly from SDMS, processing within 3 weeks. If you have any questions about the survey, please contact us at webinars@intersocietal.org. Once again, we thank you for joining us today and appreciate your participation.